So hello and welcome to the Healthy Living series in partnership with Confluence Health. I'm Ash Kuntz and I'm a STEM program manager at NCW Libraries. And it's our mission to connect people to vital resources and opportunities that foster individual growth and strengthen communities. And I'm really excited to share this opportunity to learn with you tonight. Tonight is titled Healthy Weight Loss with Dr. Andrew Toth and Jess Tyrell. Dr. Andrew Toth graduated from Loma Linda University School of Medicine and has over 26 years of experience in the medical field, specializing in family medicine and obesity medicine. And his current role with Confluence Health is the Director of Weight Management Center. And Jess Tyrell is a registered dietitian who specializes in wellness and weight management. She has a master's degree in nutrition and a bachelor's degree in food science. She pursued her career after losing 130 pounds through diet and exercise, which fuels her passion to teach others about sustainable, healthy living. In her current role, she is the dietitian for the CH Wellness program at Confluence Health, and she also partners with Dr. Andrew Toth at the Weight Management Center to treat obesity as a chronic disease through a multidisciplinary approach. So welcome, and it's all you.
Thank you, Ash. Again, the title of our talk, next slide, Lifestyle Modification, How to Reset Your Fat Mass Set Point. Most talks, I kind of do a little disclosures. I do receive honoraria for participation in the National Obesity Board that's sponsored by Novo Nordisk, and I am a partner in the Wenatchee Valley Medical Group that's contracted with Confluence Health. One last disclosure, next slide. Like my patients, I also find it difficult to get out of bed in the morning to go for a hike or run, but it's hard to resist a look like this. This is Walter. He's my dog, Border Doodle, and he is always ready to get out and get moving. So our agenda tonight is to review the lifestyle influencers that cumulatively over time cause us to gain weight and to kind of set our new normal weight higher than it was before. We're also going to review the influencers that help push that set point back down again to help us lose weight in a more sustainable way. And at the very end of the talk, we'll have a little bit of time for questions. So this is a graphic of a handout that I use in my practice on a daily basis. This tries to kind of help organize the whole thought, and I'll go through it a little bit here. And then the next sections of the talk will be to kind of go into more detail about these, each as a separate topic. To kind of get the idea of how this is set up, this black line in the center of the page represents what we call a fat mass set point. This is a fancy term for just basically saying that our bodies want to stay at the weight that they're at, and they're going to fight us if we try and change it. For example, if I weigh 250 pounds, I lose 20 pounds down to 230. My body's going to recognize that I've lost that weight, and it's going to start sending really strong signals from my brain to my stomach saying that you need to feel hungrier, you need to feel less full, you need to slow your metabolism. And those signals are going to stay really strong until my weight gets back up to that 250, and then they go back to normal levels. We can actually track those signals in animal and human studies. On this graphic, the things on the left side of the screen with the red arrows are things that can push that set point up over time. And the list of things on the right-hand side with the green arrows are things that we know can start to push that set point back down over time. So what are some of the things that push this set point up? The first thing is the quality of the food that we eat. In particular, we want to start to think about eating things that are unprocessed and keep going down. The other things are kind of when we eat energy dense types of foods or drink sugar sweetened beverages, when we lack a lot of fresh fruits and vegetables in our diet, our bodies tend to store those calories more in the form of fat than if we were eating unprocessed foods and drinking water and eating lots of fresh fruits and vegetables. Another kind of category that can push that set point up over time is unhealthy muscle. As we become more sedentary and less active, Our muscle cells actually do send out signals that tell our body how to store calories. So an active, healthy muscle cell will send out a hormonal signal that will tell the body to send more glucose to the muscle cell to manufacture glycogen to be used in that muscle cell as a form of energy. An unhealthy muscle cell that's fairly inefficient will send out a different hormonal signal saying, don't send any glucose my direction, store all of those calories in the form of fat. So as become more sedentary, our body pushes more of our calorie storage into fat storage. Another kind of major contributor that pushes our set point up is sleep deprivation. When we get less than 5 hours of sleep in particular, or if we get really disrupted sleep throughout the night, our bodies tend to store calories differently as well. And studies are pretty clear that we tend to gain weight when we don't do that. The next kind of category is disrupted circadian rhythms. And what I mean by that is that our bodies like to be in a cycle of when we go to sleep, when we wake up, but also when we eat our meals. And if we disrupt those cycles all the time, our bodies will tend to store more calories in the form of fat. One of the categories that we are actually the cause of many times is weight inducing medication. Some of the medicines that we prescribe for very serious conditions sometimes do cause weight gain. Examples of these are steroids like prednisone that we give for autoimmune disorders or asthma. Some of the antidepressants like Paxil or mirtazapine, which is Remeron, can very often cause significant weight gain. Some hormone therapies or significant low levels of thyroid hormone can also drive a lot of weight loss as well. So again, coming back to this graphic, what we just talked about was everything on that left-hand side that can drive your set point up and push that set point higher, or if you try and what this illustrates also a little bit is kind of the whole idea of a diet yo-yo. So if you lose weight, say 20 pounds with whatever method, whether that's keto diet or intermittent fasting, but you're not changing the lifestyle things that are driving your set point on that left-hand side of the page, your body's gonna push that weight right back up to where it was before, which most people that have experienced that yo-yoing kind of attest to in their own life. The next part of the conversation is what pushes that set point back down. And in direct kind of contradiction to kind of the same categories that we just talked about. Number one is the quality of the food that you're eating. So when you eat fairly unprocessed food, kind of more of a Mediterranean approach, and avoid sugar sweetened beverages, your body stores those calories much more efficiently and less in the form of fat. It's usually also very helpful to do some self-monitoring.
Yeah, so there are 3 different types of self-monitoring, which we'll talk about one on the next page, but typically there's either some sort of caloric reduction or there needs to be some sort of portion control. So it could be some form of calorie counting or journaling or just looking at some sort of portion, but it's really paying attention to how much you're eating in addition to the high quality of food that's most helpful.
Another category, again, that pushes that set point down is that getting that healthier muscle. A lot of people kind of have the misconception that they can go out there and just exercise their weight away. For most of us, it doesn't really work out that way very well. So when we talk about activity in the process of weight loss, we're talking about trying to shift your view a little bit into a different frame of mind. And what I try and kind of emphasize to patients is, first of all, I don't want people to lose the muscle mass that they have while they're losing weight. As you start to lose weight, basically by definition, you're in a catabolic state. Your body is burning its own tissue and that's how you're achieving weight loss. You want your body to pull from your fat stores, but you don't want it to be breaking down your muscle tissue, which we'll tend to want to do. There's lots of studies that show that if you get at least 20 minutes twice a week of some kind of resistance training, your body can help hold on to the muscle you have while you're losing weight. So that's one of the things that I always want to emphasize to patients is to try and preserve the muscle mass they have. Moderate exercise 3 to 5 times a week does help reduce your cardiovascular risk. it's not going to help you necessarily lose a ton of weight a lot faster, but it will help reduce your cardiovascular risk, helps with stress, anxiety, depression. There's a lot of awesome benefits that happen when you exercise and are more active, but it's not going to be the primary driver of your weight loss. Next category is good sleep. We talked a little bit earlier, if people that get less than 5 hours sleep really store calories very differently. There's lots of good evidence that people that get a good 7 to 8 hours of sleep have a much better and efficient system of storing calories. So there's a lot of things that play into that, from anxiety to previous traumas to all kinds of distractions, kids waking up in the middle of the night, cats, dogs, those kind of things. But really, the more that you can improve your sleep hygiene, the more efficient your body will be at storing calories. So some of the things we talk about is trying to set a regular bedtime, not having any real screen time in bed, try to do things to kind of shut your mind down as you get ready for sleep, and try and reduce the things that tend to wake you up throughout the night. They're all simple things, but they actually have a huge impact in getting better sleep. And people that sleep better have a much more balanced life and tend to feel more motivated to continue to work on the other lifestyle things that they're trying to do and change. Another category, again, is to try and improve those circadian rhythms. So again, trying to be consistent in your meal times. No eating within 2 hours of bedtime, trying to keep a consistent bedtime and a wake time. Some of the patients that really struggle with their weight are patients that do a lot of shift work. In my field, a lot of physicians or nurses, a lot of law enforcement as well, that do shift work where they do graveyards and then swing shift and then day shift, and then on the weekends try and go watch their kids play games or baseball games and stuff. Their circadian rhythms are really messed up and their bodies really struggle with pushing that set point up.
So I think this is the second biggest part that I talk about. Of course, nutrition is always the first, but we have a lot of people who come in that are only eating one time a day because of this. And so really the first thing that I try to do is try to separate their eating times just so that their body will actually start running more efficiently. And it's the 2 hours before bedtime, because if they're eating within that 2 hour span, that food is going to sit in their stomach all night long and trickle out just basically like a faucet, just one drop at a time. And it can really affect their sleep. And then everything else just kind of domino effects from there. So I think this is the second biggest part that I see.
And then again, to counteract the effect of some of the medicines, just be aware of those potential side effects of some of the medicines that have weight gain associated with them. Sometimes we can't avoid some of these medicines, but work with your provider to find effective alternatives if possible. If you have to be on one of these medicines, then there are some medicines that can counteract the weight gain causing part of it as well. So don't just settle for continued weight gain. There are some ways that we can try and get at this if you have to be on one of these medicines. Another thing that can help push down that set point are anti-obesity medications. I listed here the ones that I use the most and that tend to have probably the most benefit. Wellbutrin and naltrexone are two medicines that we use for a lot of other things, but they tend to help a lot with patients that almost have more of an addiction to food and have some of those addictive kind of traits in their personality and use food kind of in that addictive kind of way. Wellbutrin and naltrexone seem to work really well in that subpopulation of patients and can be very effective. Without those traits, though, it's not usually super effective. And so it's for a very specific type of situation that can be very helpful. Phentermine and topiramate are two other medicines that have been around for a long time, can be very effective. Phentermine helps with decreasing appetite and topiramate helps a little bit more with cravings. So they work very well together, but we use them separately as well as together frequently. And the last category is what we call GLP-1 agonists. They're a group of medicines that have been around now for almost 10 years that we use to treat diabetes. and they help lower blood sugar, but they also go to the brain and tell the brain that we have food in our stomach. And so our brain then tells our stomach to feel less full and less hungry. And so it really helps decrease appetite and help patients feel fuller even when they haven't eaten as much. And so they can be very useful in weight loss as well. And so one of the strategies that we use frequently is with people with that struggle with diabetes as well, is to use one of these agents to help them stick with their caloric restrictions and their lifestyle changes, and makes just a little bit easier for them to do that. So those are probably the most effective medicines that we're using right now. It's pretty exciting time to actually be a part of obesity treatment, because in the pipeline, there's about 7 or 8 other medicines that are in phase 2 and phase 3 trials right now that I'm hoping over the next 5 to 10 years, we'll have a lot more tools available that kind of get this problem of obesity in different ways. So really exciting to be a part of seeing that kind of unfold. There's a new one, a GIP-1 agonist, that's actually been approved this month in May. That's going to be coming out. So exciting things. Another thing that can push that set point down is bariatric surgery. And this includes both gastric sleeve and gastric bypass. Studies show that getting a surgery like this can push your set point down by about 20%. And so if someone weighs 300 pounds, they can reset that set point down by almost 60 pounds. Now, this is just one tool in the toolbox. It has to go alongside all of the other things that we've been talking about, because people that get this surgery can still, if they don't change the other things like getting better sleep patterns, if they continue to eat processed food, if they continue to not be active, they can push that set point back up again over time. So it's not the magic bullet that some people hope it's going to be, but it can be a very useful tool that some patients can get really a good benefit from. We don't really recommend the lap band that much anymore. It's a purely restrictive approach, whereas the gastric sleeve and gastric bypass have both a restriction and absorption component, but also they increase some of the hormones that help you feel fuller as well. So seem to be much more effective long-term than the lap band. So again, this is coming back to this kind of the structured handout here. We just went through all the things on the right-hand side of that can help push that set point back down over time. Usually these are the things that I kind of, when I'm talking to a patient, we try and come up very concrete and specific things in each of these areas that they can start to work on to help them start to push their set point down in a sustainable way. So some of this, the repercussions of the fat mass set point, I already mentioned this one, the diet yo-yoing effect, where if you're not changing the things that kind of reset that set point, no matter what method you use to restrict your intake and lose weight, you're going to tend to regain that weight and do the whole diet yo-yo. This is a big part of what we call weight recidivism, which again, people that lose the weight and then tend to regain it later. It's usually, even if they've done the lifestyle changes and then they kind of relapse and stop doing that, and they start, again, eating very processed foods and struggling with their sleep, or a crisis comes up and they stop doing the things that got them to that point, they'll tend to have that weight regain. And really, it's the source, I think, of a lot of frustration for a lot of patients when they see a lack of progress, is oftentimes because they're not addressing a lot of these factors that can push that set point back down. So if it seems a little bit overwhelming, I encourage you guys not to get discouraged. There are some pretty good science that has come out over the last 5 to 10 years or so. We have better tools as far as medicines, and we're starting to understand things a lot better. Remember that there is a joy in the journey, and to keep your eyes focused on it's a long journey, and it takes a lot of small steps, but eventually, as you look back, you'll find that you've come a long way. We have time for some questions now.
One thing that came up for me is you're talking a lot here about the tools of the actual weight management. But like, how is it that we go about determining what that healthy set point is to be at?
So it can be different for every patient. So I usually, when we talk about kind of goals or healthy weights and those kind of things, I try not to get too much caught on one specific number, but oftentimes we'll use a body composition to kind of help guide patients to what would be kind of healthy for them. In general, and it's different between male and female. For women, we try to get their percentage of body fat down below 30%. And we can kind of figure out what their weight might be at that percentage, because everybody's a little bit different. If they are carrying a lot of muscle mass or a lot of bone mass, that can be a little bit different weight. And so it's not based strictly upon BMI, which it only takes into consideration your height and weight. And that's why I don't like to use that very often. I'd prefer to use the percentage of body fat. For men, it tends, we kind of want to get them under 25% body fat as a goal.
We have a question, and how is age a factor in weight loss?
I think one of the things, as you get older, it's much harder to gain muscle, and it's easier to lose it. And so you want to be really cautious as you get older in the way that you lose weight, because you don't want to lose your muscle mass, because it's going to be really hard to get it back. And so that's why the body composition, I think, is really helpful in this population of patients, because I actually do track that, and we try and counteract that as much as we can. But I think there's a danger as you get older. If you're not careful, you can lose that muscle mass pretty quick if you're really pushing your weight down.
I think a lot of the times too, it does come down to the protein part of it. And a lot of the times there is more of a simple carbohydrate that will come into play. That might be just more of a habit that people have eaten for a long time. And so then I need to come in and add more protein in to try to maintain the muscle mass. And so I might be tweaking their diet a little bit differently than I would somebody who might be younger. But that's where it can be very individual.
I think the other thing I would add is, a lot of times the amount of high quality food that we are recommending for weight loss comes down to the person's metabolism or their metabolic rate. And that is not a static number. It can change throughout your life. And there's a lot of different things that can affect that. Going through menopause tends to affect your metabolic rate. Women that struggle with polycystic ovarian syndrome tend to have a lower metabolic rate. If you have hypothyroidism, it affects your metabolic rate. And so as if you're looking at age as a factor in some of these concepts, you have to take into consideration sometimes these life events as we're getting older that can affect our metabolism, and that will then affect what the intake recommendation would be.
Gotcha. And then there was a question about the anti-obesity medication and if that's generally covered by state insurance.
At this point in time, most insurances, both private and state, do not cover anything for obesity care. So this, if we're talking about information, it would be great to write your state legislature and other politicians, national level, to kind of advocate for better treatment for obesity, because most insurances will not cover obesity care.
Is that because it's not considered preventative care? Because most insurances do cover preventative care.
I don't want to get into too complicated of a thing, but CMS, Center for Medicare, when they were kind of drawing up whatever legislation they were doing, they did not classify obesity as an actual disease. And this was like 15, 20 years ago. And we've been trying to get that changed since then. But because it's not classified as an actual disease, insurance companies are not required to pay for it, even though it's the kind of the underlying root cause of diabetes, obstructive sleep apnea, hypercholesterolemia, all these other hypertension, all these other significant medical issues are all tied to weight. So there is an actual legislative act called the Treat and Reduce Obesity Act, TROA, that they've been trying to pass through Congress for the last 5 to 6 years, that would actually classify obesity as a disease, and would change all of this. But we just haven't had any traction on that. They've been trying to include it on various omnibus bills, but it hasn't been passed yet. So that's kind of a long answer, but that's the background of that. So anything anybody out there wants to do to advocate for that, that'd be awesome.
Are there any specific combinations of food that tend to aid in weight loss?
This is a yes and no question. So what we teach within the center is we always take Mediterranean style approach. So yes, on the specific combinations, because we're looking at kind of that as a basis. And so the way I teach it is it comes down to really how you pair your food together. So I always recommend to have a fruit or a vegetable, and then always pair it with a protein. And then at mealtime, I like to put in the carbohydrates, just because that's where you're going to get your main source of energy. And you want your protein to go in and do that job of telling your brain it's that signal of you're full and satisfied and you can stop eating. And you don't want the carbohydrate and the protein to work against each other. So always protein with a carbohydrate and a fruit or a vegetable. And that's really what I've seen be the best in helping for weight loss. And then you're also more satisfied, and you can eat smaller frequent portions. And so it just helps the overall big picture.
And does drinking water, like being well hydrated, help with that, as well as like balancing a lot of those other things?
It does, because if you are dehydrated, then your body will actually send out fake hunger signals, so that you'll actually think you're hungry instead of thirsty. So when you're hydrated, you can actually stick closer to those smaller frequent portions.
Awesome. And then this next question is a two-part question. And is belly fat worse than other fat? And why is it that as you get older, you get more belly fat?
I don't like the term belly fat. So the terms that we actually use are subcutaneous fat in the abdomen region, or in the belly region, versus visceral fat. Okay, so when we talk about visceral fat, that's actually the fat that's inside your abdominal cavity. It's around your intestines, it's around your liver. And yes, the more visceral fat that you have, you tend to have a higher risk of metabolic disease and cardiovascular disease. And so people that have really high visceral fat numbers tend to have more heart attacks and strokes. That's different than the subcutaneous fat that's between your muscle and your skin in your belly. And so that is not necessarily associated with higher cardiovascular risk. And so when we try and judge people's or assess people's health and their risks for greater consequences, we are concerned about the amount of visceral fat they have. It's not, as you get older and usually more sedentary and tend to gain more weight, you tend to gain more weight in that visceral area. And so that's why as you get older, you tend to have a little bit more visceral fat. But someone that is very active, eating healthy quality of food in the right amounts, not gaining weight, is not going to have too bad of a visceral fat as they get older. And that, again, will reduce their overall risk, if that answers the question.
And then is low energy, can that be a result of weight gain?
In general, I mean, that's a very vague term as far as low energy. But there's so many different things that can cause that, from anemia to depression to all kinds of things. But in general, people that, I guess I could answer this conversely, as people tend to lose weight and change their lifestyle, and they're getting more active and they're eating healthier and they're getting better sleep, they tend to have more energy. And so again, all of these lifestyle things are very intertwined together. And if you aren't sleeping well and you're not eating, you're eating a lot of processed foods, and you're not having a good balance of stress in your life, and all these things, then people tend to have less energy and be more tired. And so I think it's hard to separate out just one of those symptoms from the others.
What type of resistance training is better for weight loss, especially for older folks?
So when I'm talking about resistance training, what I'm referring to is kind of either really lightweight or those resistance bands. And you need to kind of do both upper and lower body. What you're doing, again, the concept here is that you're trying to tell your body that you're still using these muscles and they shouldn't be using them as a source of energy. And so you just want to use them enough that your body says, hey, these are off limits. Let's not break them down as a source of energy. So it doesn't have to be heavy weights or a ton of repetitions. It's just using them enough to prevent muscle loss.
But basically what a lot of this is that if you're having questions about what has a healthy weight point for you or things like this, is that you should in fact go see a care provider at Confluence Health or one of the other locations in town.
Yes. No, I think, have a good conversation with your primary provider. They should be able to kind of help you kind of navigate some of this, and take a look at at the medicines that you're on, and try and start to implement some of these kind of basic lifestyle things that we've all heard before, but I think it's helpful to kind of think of how they're all intertwined and how they actually are all contributing to pushing that set point up. We've all heard, you need to get better sleep and you need to eat better types of foods, and you need to go to bed on time and not eat with, but the reason is that they're all pushing that set point up or down. And so I think it's very practical and actually can have a huge impact.
I feel like nutrition wise, there's a lot of misconception out there, even about dietitians and what they've been told. And so the approach that we like to take in the clinic is we try to meet people where they're at, and then we're looking at that set point, and we really are going in trying to work on those pieces of looking at the quality of the nutrition and how often somebody's eating and what the food groups are. And so we're not in there trying to take things away or point them in the wrong direction, but we're really trying to focus on building the habits to get them into the overall lifestyle changes and push them in the right direction in a good, sustainable way.
I'll do a little pitch for our next program in the series, which is next Wednesday, May 11th at 7 p.m. as well. And it's on sleep. So talking about healthy weight loss management, learn how to get some better sleep with Dr. Patel. You can learn about all of these on our website at ncwlibraries.org or by following us on Facebook. But thank you again for your time this evening.